Hello everyone. Today's class we are going to study about the acquired or adaptive immunity. This is the second type. The last time only we have discussed about the innate immunity. So today we are going to see the remaining type or second type of immunity, that is acquired or adaptive. So the resistance acquired by an individual during the life by recognizing and selectively eliminating the specific foreign molecules. So this immunization or this immunity power is not present in our body by birth itself. We have to take from outside, and it provides the second line of defense against the infection, where we have seen that innate immunity is providing the first line of defense, but this acquired is providing the second line of defense. Next is characteristics of acquired immunity. There are four characteristics: antigen specificity, diversity, immunologic memory, and the self and non-self recognition. The first one is antigen specificity. Immune system or antibodies can distinguish among antigen even between the two proteins that differ in only one amino acid. Means this type of immunity has a power to differentiate between the two antigen, but which is as having same protein, but they are indifferent only in one amino acid. The second one is diversity. Immune system is capable of generating the large antibodies diversity in its recognition of molecules. The third one is immunologic memory. Means the immune system exhibit the memory on the second encounter of same antigen by generating a secondary response which is more specific and quick. Means if some disease condition already occur in the body first time, that some pathogen already attacked, when they attack second time, the body will show the quick response. That's why they have told they have immunologic memory. They will remember the pathogens. Next one is self and non-self recognition. It does not react with the body's own molecules but effectively eliminate the foreign antigen. Means they know which one is body's own pathogen and which is coming from outside. So they will attack only against the foreign bodies, not inside the bodies. Types of acquired immunity. There are two types. One is active and passive. Active is again divided into two more types, that is natural active immunity or artificial active immunity. Passive also divided into two more types, that is natural passive immunity and artificial passive immunity. The first one is active immunity. It's also as adaptive immunity, and its resistance developed by an individual as a result of an antigenic stimuli. And it is used for the prophylaxis to increase the body resistance. It has two types. One is natural, one is artificial. Passive immunity is resistance transmitted passively to a recipient in a ready-made form. Okay, it is transferred from the outside, which is made in the lab, and it is transferred to the patient body, but patient body don't have any role here. Okay, and it is used for the acute infection, and it has two types, natural and artificial. Now I am going to tell you the difference between the active and passive immunity. The first one is active immunity produced actively by the host immune system, but passive immunity, it is received passively and no active participation of host immune system. Active immunity is induced by infection or by an immunogens. But in the passive immunity, it is conferred by the administration of ready-made antibodies. And the next one is active immunity is long-lasting and effective, whereas the passive immunity is short-term and less effective compared to the active. Active immunity is only after lag period. Okay, it is effective only after lag period, and but passive can do their function immediately. Active immunity is have a memory, that is immunological memory, but passive they don't have any memory. Active immunity booster effects on the subsequent dose, but the passive there is no subsequent dose. Okay, or it is less effective. Active immunity has negative phase, but passive they don't have. And active can be applicable, not be applicable for the immunodeficient patient, but the passive can be applicable for the immunodeficient patient. Like next we are going to see the types of active immunity. As you know, there are two types, one is natural, one is artificial. The first one is natural. It is the result from either or a clinical inapparent infection by a microbes using the long lasting example Person recovering from chickenpox or measles develop the natural active immunity. You may know that if the person got chickenpox in their life, they'll not get it second time. Why? Because in the second time their body will be ready with the antibody if the same virus affect the body. Okay, so that is called as natural active immunity. No need to take any vaccine from the outside. Body itself naturally produce the immunity power. Next one is artificial active immunity. So in this all the vaccine will come, whatever you have taken from your childhood to till your date. Like so many vaccine are available, BCG, okay, typhoid, oral polio vaccine, okay, TT, and now again everyone is waiting for this COVID-19 vaccine. So this all comes under the artificial active immunity. Next we have types of passive immunity. In that first one is natural passive immunity. So in that what happened, the resistance passively transfer from the mother to the fetus or infant through the placenta, transplacentally and through the milk, that is colostrum. So what happened in the natural passive immunity? From the mother it will go to the fetus. Fetus means unborn baby. When they are in the mother womb, when not they are delivered, that time we will call them fetus. How it will transfer? Through the placenta. Placenta is a, you can say, 1 foot 5. Okay, like through that only from the mother all the nutritious things it will go to the baby's body. Or after the delivery through colostrum it will transfer from the mother to the baby. So this is also natural, but it is passive. In the baby's body nothing is happening. Ready-made form only they are getting from the mother. Next one is artificial passive immunity. It resistance passively transferred to a recipient by administration of antibodies. It agent use hyperimmune sera of animal, conversion sera, full human gamma globulin, and these are used for the prophylaxis and treatment purpose. Next one is combined immunization. So by name itself you can identify. Combined means combination of two things. Yes, so if you are going to give active and passive method both type of immunization, then we will call it is combined immunization. Example is TIG. Okay, the protection of non-immune individuals with a tetanus prone wound, that is injection of TIG, tetanus immunoglobulin, in one arm and first dose of tetanus toxin in another arm, followed by full course of phased tetanus toxide injection. Okay, so this is called as combined immunization, combination of active and passive. Next one is local immunity. The natural infection or live vaccine administered orally or intranasally provide local immunity at the site of entry such as gut mucosa and nasal mucosa. And immunoglobulin A plays an important role in the local immunity. See, local means what? In some particular site, not in whole body, only for a part of the body. That's why we call it local immunity. The next one is herd immunity. The overall level of immunity in a community, okay, like for everyone, for group of people. Community means where so many people are staying together. Is relevant in control of epidemic disease, like what we are suffering now. In case of epidemic or pandemic disease, like if you are giving vaccine to only one people or two people, we can't control it. We have to give to the whole community area to control the communicable disease. So that is called as herd immunity. Next we are going to see that universal immunization program. Okay, UIP, universal immunization program. So the universal immunization program launched in India on November 19th 1985 and originally known as expanded program on immunization, that is EPI, according to WHO in 1974, to protect all children of the world against the 6 vaccine preventable diseases, that are diphtheria, whooping cough, tetanus, polio, tuberculosis and measles. So this program was implemented or launched to control the vaccine preventable disease. Means if they give the vaccine, the disease can be prevented. There are 6 diseases. That's called as 6 killer disease. Okay, but for this vaccine is available. So that everyone should get that vaccine to prevent this disease, they have launched this program. So immunizing agents available in 3 forms. One is vaccine, one is immunoglobulin, one is antisera. The first one is vaccine. And how they prepared? Immunobiological substance designed to produce the specific protection against a given disease. And nowadays vaccines are of subunit or recombinant types, administration of subcutaneous and intramuscular. What are the forms of vaccine? There are three forms. One is live, one is inactivated, one is toxoid. Example of live vaccine is BCG and MMR. Okay. An example of inactivated or killed vaccine are IPV or hepatitis B. An example of diphtheria or toxoid are vaccines are diphtheria and the tetanus. So these are the three forms of vaccine. The full form of BCG is Bacilli, Calmette, Guerin, and MMR means measles, mumps, rubella. IPV means inactivated polio vaccine. Next is immunoglobulins. Immunoglobulins are for the passive immunization, and there are 5 types of immunoglobulins, that is immunoglobulin G, M, A, D and E. And you can have, there is 2 more types, that is normal human immunoglobulin and specific human immunoglobulins. These are used to replace the antibodies in immunodeficient patient. Immunodeficient patient means whose body is unable to produce the immunity. Okay, and it is administered through intramuscular or intravenous. Intramuscular means into the muscle, intravenous means into the vein. So I have already told you the difference between the live, killed and toxoid vaccine. The next one is anti-sera. The materials prepared in animal and antitoxin prepared from the non-human source included tetanus, diphtheria, botulism, gas gangrene and snake bite. How should the vaccines to be stored in the PSC? In that, first is the cold chain facility. So what is cold chain? It is a system of storage and transport of vaccine at low temperature from the manufacturer to the actual vaccinated site. So it is a process, or you can say it is a system where they, after the preparation of the vaccine, they will store and they will transfer to the site where the actual vaccination is happening. In that also we have 2 types of storage. One is freezer, one is non-freezer. So in the freezer vaccine we have to give polio and measles. In the non-freezer vaccine we have to give typhoid, DPT, tetanus, DT and VCG. DPT means diphtheria, pertussis, tetanus. DT, diphtheria, tetanus. Now I am going to tell you the equipments what is needed for the cold chain system. That is walk-in cold room, deep freezer, okay, or small deep freezer and ILR, okay, and that is ILR means ice linked refrigerator, cold boxes, vaccine carriers, day carriers and ice packs. Next we are going to study about the adverse effect of vaccine. So there is a chance of local reaction due to the faulty techniques, reaction due to the hypersensitivity, neurological involvement, probactive reaction and other damage, like if the mother is pregnant it can damage to the fetus also. Next one is precaution you have to take to prevent the adverse effect of vaccine. For that, the first point is test for sensitivity reaction, means to see that the patient is having any allergic reaction or not. Next, keep ready adrenaline. Properly sterilize the equipments and apparatus, like whatever equipments you are going to use during the procedure. Measles and BCG vaccine to be constituted only with the diluents supplied by the manufacturer. Reconstituted vaccine must never be written or substitutes used, and don't store anything else in the refrigerator other than the vaccine. So with this I have finished this universal immunization program. Now we are going to study the national immunization schedule. National immunization schedule, okay, like in which age, what are the dose and which vaccine to be given. In that, first one, for infants at birth we are going to give BCG 0.1 ml or OPV, oral polio vaccine 2 drops. BCG we are going to give intradermal, that is into the dermis. At the 6 weeks BCG 0.1 ml and the route will be same, but if it is not given at the birth, if it is given at birth, no need to give. And we are going to give DPT first dose 0.5 ml and OPV first dose 2 drops. DPT we are going to give IM, that is intramuscular, into the muscle. At 10 weeks, DPT second dose, OPV second dose. At 14 weeks, DPT third dose, OPV third dose. And 9 to 12 months, measles, how much? 0.5 ml, route will be subcutaneous, and vitamin A 2 ml, route will be oral. Oral means through mouth. At 18 months, okay, DPT and OPV booster dose 1. At 24, 30 and 36 months, vitamin A 2 ml oral. At 5 to 6 years, DT booster dose 2, that is IM. At 10 to 16 years, tetanus toxoid IM. And for the pregnant lady in the early pregnancy, TT1 IM. And after the 1 month of TT1, they can go for TT2, that is IM only. TT means tetanus toxoid. So this is the immunization schedule for everyone. For everyone after the till their age of 16, they have to go for this all vaccine according to the schedule. With this, we have completed the universal immunization program. Thank you everyone.